Hello all. In this video, we are going to discuss about various types of bias in research. Before understanding bias, we should know about what is an error. Error is any deviation of study results from truth. Our study result may be aiming at measuring a number or percentage or finding a relationship. So any deviation in any of this will result in error. When this error happens randomly in all directions, it is called as random error. It is inevitably present in any kind of study and it can be reduced only by increasing the sample size. When this error causes systematic deviations from truth in a particular direction, then it is called as systematic error or bias. It cannot be minimized by increasing the sample size. It can be minimized only by increasing the quality of the study. A study with more random error is not precise, but a study with systematic error or bias is not accurate. Biases can occur at any stage of the research. During the first stage, planning, the most common type of bias is selection bias, which can be minimized by a good eligibility criteria, that is, a good inclusion and exclusion criteria. Following bias such as healthcare bias, length bias sampling, Neyman bias, survivor bias, Bergson's bias, healthy worker effect, volunteer bias, exclusion bias, matching bias are considered as subsets of selection bias are related to selection bias. But other types of bias which we can eliminate at the planning stage is the misclassification bias, which can be eliminated or minimized by a good study protocol, and the allocation bias, a method where the participants are being allocated to study and control group has been biased. So that is allocation bias. It can be minimized only by randomization. And in the planning stage, we can eliminate this ascertainment bias by a good study tool. So these are all the common bias, out of which selection bias is the most common bias at the planning stage. Now during the implementation stage, the most common bias is the information bias, which can be eliminated by blinding. Interviewer bias, subject bias, recall bias, Hawthorne effect are all subsets of information bias. While blinding can effectively reduce interviewer bias and subject bias, this recall bias, Hawthorne effect cannot be reduced by blinding. Attrition bias is another bias which is important during the conduction of the research, that is due to the bias in the follow-up. Publication bias, that is selectively reporting the findings or purposefully missing the findings for the sake of publication or for the sake of compulsion of any other external funding agencies. Now, confounding bias occurs when we are finding a relationship or association between two variables, that is between an exposure factor and the outcome factor. Third variable, which is related with the exposure and the outcome variable and distributed unequally among the study and the control group, decides the outcome, not the exposure. So that is called as confounding. It can be eliminated by matching, randomization or restriction or stratified analysis. The difference between confounding and effect modifier. In this example, I am going to explain the difference between confounding and the effect modification. Here is a case of confounding, where we were studying the alcohol use as an exposure and the bladder cancer as the outcome. Our preliminary study result says that there is a significant association. When smoking plays the confounding role. So when we do a stratified analysis among the smokers and the non-smokers, the same exposure and the outcome, there will not be any association. Whereas in effect modification, this is not truly a bias. It is naturally present in the study. We have to identify those effect modifiers and differentiate those effect modifiers from confounding. So in crude analysis, similar to the confounding, we will get a significant association. So in this example, the exposure is use of oral contraceptive and the outcome is the breast cancer. When we keep looking at the role of family history as the effect modification, when we are doing a stratified analysis, among the positive family history of breast cancer participants, the use of oral contraceptive shows strong association, whereas the no family history of breast cancer group don't have any association. These type of differential results among the stratified analysis means that the exposure and the outcome has effect modification role by the family history. In reality, for any research, multiple errors and bias can occur which affect the study results in different direction. That is, one bias may overestimate the results while other bias may underestimate the results. Summarize, error is any deviation of study result from the truth. Bias is systematic deviation results from the truth. Minimized by increasing the sample size, and it is less dangerous when compared to the bias which can be minimized only by increasing the methodology of the study. Can be multiple, that is more than one bias exists in any research. Then the third, while selection bias can be minimized by good eligibility criteria and randomization, information bias can be eliminated by blinding. Confounding bias can be eliminated by randomization, matching, restriction, and most commonly by stratified analysis. Aware of these biases and the techniques to eliminate it will help us to do a better research or a bias-free research.